is Herfina Nabilla Zulman. I'm from class R4B and I'm going to explain performance enhancing drugs. Know the risk. Most serious athletes will tell you that the drive to win is fierce. Besides the satisfaction of personal accomplishment, athletes often pursue dreams of winning a medal for their country or securing a spot on a professional team. In such an environment, the use of performance enhancing drugs has become increasingly common. But using performance enhancing drugs but using performance enhancing drugs or doping has risk. Take the time to learn about the potential benefits, the health risk, and the many unknowns regarding so-called performance enhancing drugs such as anabolic steroids, androstenedione, human growth hormone, erythropoietin, diuretics, creatine, and stimulants. You may decide that the benefits aren't worth the risk. Some athletes take a form of steroids known as anabolic androgenic steroids or just anabolic steroids to increase muscle mass and strength. The main anabolic steroids hormones produced by your body is testosterone. Testosterone has two main effects on your body. Anabolic effects promote muscle building. Androgenic effects are responsible for male traits such as facial hair and a deeper voice. Some athletes take straight testosterone to boost their performance. The anabolic steroids used by athletes are often synthetic modification of testosterone. These hormones have approved medical uses, but improving athletic performance isn't one of them. Why are these drugs so appealing to athletes? Besides making muscle bigger, anabolic steroids may reduce the muscle damage that occurs during a hard workout, helping athletes recover from the session more quickly and enabling them to work out harder and more frequently. Some athletes, as well as non athletes, may like the muscular appearance they get when they take drugs. Designer steroids. A particularly dangerous class of anabolic steroids are the so-called designer drugs. Synthetic steroids that have been illicitly created to be undetectable by current drug tests. They are made specifically for athletes and have no approved medical use. Because of this, they haven't been tested or approved by the Food and Drug Administration or FDA and represent a particular health threat to athletes. Risk. Many athletes take anabolic steroids at doses that are much higher than those prescribed for medical reasons. Anabolic steroids have serious physical side effects. Men may develop 1. Prominent breast, 2. Shrunken testicles, 3. Infertility, 4. Prostate gland enlargement, and women may develop 1. A deeper voice, which may be irreversible, 2. An enlarged sclerosis, which may be irreversible, 3. Increased body hair, 4. Baldness, which may be irreversible, 5. Infrequent or absent periods. Both men and women might experience severe acne, increased risk of tendinitis and tendon rupture, liver abnormalities and tumors, increased low density lipoprotein or LDL, cholesterol or the bad cholesterol, decreased high density lipoprotein or HDL, cholesterol or the good cholesterol, high blood pressure or hypertension, heart and blood circulation problems, aggressive behaviors, rage or violence. Physiatric disorders such as depression, drug dependence, infection, or disease such as HIV or hepatitis if you are injecting the drugs. Inhibited growth and development and risk of future health problems in teenagers. Taking anabolic androgenic steroids to enhance athletic performance is prohibited by most sports organizations and it's illegal. In the past 20 years, more effective law enforcement in the United States has pushed much of the illegal steroids industry to the black market. This poses additional health risk because the drugs are either made in other countries and smuggled in or made in clandestine labs in the United States. Either way, they aren't subject to government safety standards and could be impure or mislabeled. Androstenedione. What is it? Androstenedione or andro is a hormone produced by the adrenal glands, ovaries, and testes. It's a hormone that's normally converted to testosterone and a form of estrogen or estradiol in both men and women. Andro is available legally only by prescription and is a controlled substance. Its use as a performance enhancing drug is illegal in the United States. Manufacturers and bodybuilding magazines tout Andro's ability to allow athletes to train harder and recover more quickly. Scientific studies that refute these claims show that supplemental androstenedione doesn't increase testosterone and that your muscle don't get stronger with andro use. Risk side effects of andro in men include 1. Acne 2. Diminished sperm production 3. Shrinking of the testicles 4. Enlargement of the breasts 5. In women, side effects include 1. Acne 2. Masculinization such as deepering of the voice and male pattern baldness. In both men and women, andro can damage the heart and blood vessels, increasing the risk of heart attack and stroke. Human growth hormone. What is it? Human growth hormone is a hormone that has an anabolic effect. Athletes take it to improve muscle mass and performance. It hasn't been shown conclusively to improve either strength or endurance. Human growth hormone is available only by prescription and is administered by injection. Risks. Adverse effects related to human growth hormone range in severity and may include joint pain, muscle weakness, fluid retention, diabetes, vision problems, erythropoietin. What is it? Erythropoietin is a type of hormone used to treat anemia in people with severe kidney disease. It increases production of red blood cells and hemoglobin to the protein that carries oxygen to your body's organs. Taking erythropoietin improves the movement of oxygen to the muscles. Apotin, a scientific form of erythropoietin, is commonly used by endurance athletes. Risks. Erythropoietin use among competitive cyclists was common in the 90s and allegedly contributed to at least 18 deaths. Inappropriate use of erythropoietin may increase the risk of stroke, heart attack, and blockage in an artery in the lung or pulmonary embolism. Diuretics. What are they? Diuretics are drugs to change your body's natural balance of fluids and salts, or electrolytes, which can lead to dehydration. This loss of water can decrease an athlete's weight, which many athletes prefer. Diuretics may also help athletes pass drugs tests by diluting their urine, are sometimes referred to as a masking agent. Risks. Diuretics taken at any dose, even medically recommended doses, predispose athletes to adverse effects such as dehydration, muscle cramps, dizziness, potassium deficiency, drop in blood pressure, loss of coordination and balance, death. Creatine. What is it? Many athletes take nutritional supplements instead of or in addition to performance enhancing drugs. Supplements are available over the counter as powders or pills. Creatine monohydrate is a supplement that's popular among athletes. Creatine is a naturally occurring compound produced by your body that helps your muscles release energy. Scientific research indicates that creatine may have some athletic benefit by producing small gains in short term bursts of power. Creatine appears to help muscles make more adenosine triphosphate or ATP, which stores and transports energy in cells and is used for quick bursts of activity such as weightlifting or sprinting. But there is no evidence that creatine enhances performance in aerobic or endurance sports. Risks. Possible side effects of creatine that can decrease athletic performance include stomach cramps, muscle cramps, weight gain. Weight gain is sold by athletes who want to increase their size, but with prolonged creatine use, weight gain is more likely the result of water retention than an increased mass in muscle mass. Water is drawn into your muscle tissue away from other parts of your body, putting you at risk of dehydration. It appears safe for adults to use creatine at the doses recommended by manufacturers, but there are no studies investigating the long term of using creatines. Stimulants. What are they? Some athletes use stimulants to stimulate the central nervous system and increase heart rate and blood pressure. Stimulants can improve endurance, reduce fatigue, suppress appetite, increase alertness and aggressiveness. Common stimulants include caffeine and amphetamines. Cold remedies often contain stimulants, ephedrine or pseudoephedrine hydrochloride. Energy drinks, which are popular among many athletes, often contain high doses of caffeine and other stimulants. Energy drinks are popular among many athletes, often contain high doses of caffeine and other stimulants. The street drugs cocaine and methamphetamine are also stimulants. Risks. Although stimulants can boost physical performance and promote aggressiveness of the field, they have side effects that can impair athletics performance, including nervousness and irritability, which make it hard to concentrate on in the game. Insomnia, which can prevent an athlete from getting needed sleep. Dehydration, heat stroke, addiction or tolerance, meaning that athletes need greater amounts to achieve the desired effect, so they will take doses that are much higher than the intended medical dose. Other side effects include heart palpitation, heart rhythm abnormalities, weight loss, tremors, mild high blood pressure or hypertension, hallucination, stroke, heart attack, and other circulatory problems. The bottom lines. Do performance enhancing drug boost performance? Some athletes may appear to achieve physical gains from such drugs, But at what cost? The long-term effects of performance-enhancing drugs have not been rigorously studied, and short-term benefits are tempered by many risks. Not to mention that doping is prohibited by most sports organizations. No matter how you look at it using performance-enhancing drugs is a risky business. Thank you. Assalamualaikum warahmatullahi wabarakatuh.